Okay, we want to start this video by talking about lipids, but I want to really emphasize that carbohydrates are carbon, hydrogen, and oxygen, and they usually have carboxyl groups. Hydroxyl groups. Lipids are hydrogen, carbon, and oxygen, and usually have carboxyl groups. In your diet and in your blood, most of your lipids are triglycerides. Triglycerides basically are the precursors or building blocks of fat, and the other building block is glycerol. A triglyceride is 3 fatty acids attached to a glycerol molecule, and triglycerides are the way you get most of your fats in your diet. Vegetable oils, for example, and so forth. If triglycerides are high in your blood, it indicates a diet that's perhaps a diabetic, or that you've been eating too much sugar. And because triglycerides are the precursor to fat storage, for example. Phospholipids are important because they make up the bilayer sandwich of your cell membranes for every cell in your body. Sterols are important because they are precursors to many of the fat-soluble hormones. In fact, if a person is too skinny and does not have enough fat, that is, if people are undernourished, one of the effects is hormone imbalance, and we would find that starving people would not develop properly. Children would not begin sexual maturity until they are much older. Women would stop menstruating, for example. There'd be a general calamity in the realm of your hormones. In your body, in addition, adipose tissue is under your skin, and it provides cushioning. It also surrounds some of your organs and provides cushioning and protection for those, especially your kidneys. As a storage commodity, fats are stored in your bone marrow and around your belly, in your legs and butt primarily. And then you also have brown fat. This is a relatively recent finding that you have brown fat. Brown fat is thermogenic, and it's found that in response to cold temperatures, brown fat disintegrates to release heat. And actually, a couple of years ago, there was a lot of advertising for people to go into these clinics or whatever exercise places and get cold sculpturing. They would put ice packs around your middle for a period of time. Sort of like the tanning with a sun lamp type business. Well, we haven't heard much about that lately, so I guess people figured out it just really didn't work. But it seemed like a good idea at the time because it was a new discovery about what happens to the fat in our body when we are exposed to cold temperatures. But it's probably more important to certain wild animals than it is to humans. In terms of our health, one of the things we need to be aware of is that if we eat too much fat, we can create a situation called atherosclerosis, basically hardening of the arteries. Okay? So if you have elevated blood levels of low density lipids, it is possible that there can be some damage to the epithelial lining of arteries, and this might cause lipid deposits in this, say, crack in the artery, and that can narrow the artery and cause cardiovascular distress. If you haven't watched it at this point in time yet, you should look up at YouTube and find a YouTube video called The Anatomy of a Heart Attack. It starts with a guy playing basketball, and I think the thumbnail will show something like this, a guy holding his chest. And it goes through the process of what he is looking at like and how he is feeling before his friends finally realize that he needs an ambulance. And then what the ambulance paramedics do and what the doctors do in the hospital. It's a 10 to 15 minute video. It's really worthwhile watching, and it might help you to make the proper decision someday, which would lead to saving somebody's life in case you're ever exposed to somebody with that happening to them. Most of the time you would not recognize it if you don't have experience, and you might be afraid to call the emergency vehicle, emergency services, the ambulance, too quickly. But you know what? The faster you do, the better the chances of survival and the least damage that would be long-term damage to that person's heart. So it's better to err on the conservative side of being a little paranoiac than to wait too long and then have the person die. Okay, so let's back to this. So lipids accumulate in the lumen underneath the epithelium, cause a bump, and that causes narrowing of the artery, and that can deprive parts of the heart muscle, or any muscle really, from having enough oxygen. So muscle cells can die. And remember, when muscle cells die, they can't be replaced. They don't regenerate. They just get bigger to grow, and they might have multiple nuclei to support their function, but they do not replace themselves. So it's very serious if you lose muscle cells, especially in your heart. Okay, what can happen if we have this damage here that might happen before a heart attack happens is a thrombosis. And a thrombosis is basically a blood clot. Remember, this can happen any place in the body. Thrombosis is a blood clot that breaks loose and travels, and it's very common in people who have knee surgery. I had a friend that had 2 of these happen. Very painful when it hit his lungs. It can actually stop your breathing, but he survived both of his episodes, thank goodness. He was a fairly young man. And then if the thrombus formation breaks loose and travels, and then it's called, what he had is called an embolism. Embolism, okay? So let's talk about another aspect of diseases and problems, that the genetic aspect of what happens here. So let me type this while I'm discussing it, okay? So let's suppose that we have a diet that's too high in low density lipids, cholesterol, which come from animals, not plants. But if you reduce your diet and eat Cheerios and quit eating the greasy fats, you would reduce your LDL a little bit, but not a whole lot, maybe 10% if you're very strict. And the reason is because cholesterol is an important precursor to the hormones in your body, and your liver will make it if you don't eat it. So you can't stop that. But that doesn't mean you should go out and gorge yourself on fatty foods. Because if you do, and your arteries clog up, then that can kill you. Well, let's take a look at what happens. Let's suppose, and I'm going to give this an AA, and I'm going to make it bigger so we can take a look at it. Let's suppose we're an AA. It means we're dominant and we're homozygous for the ability to move cholesterol off the membranes of our cells. Then we're really normal and work out pretty well. We don't have to worry too much about dietary cholesterol unless we just are a piggy. But there's two other conditions that can occur. We could be a heterozygote, where the small a indicates we don't have the ability to really handle that cholesterol and degrade it. Well, if we're a double recessive, homozygous recessive for that, there's not much the medical community can do for us. We're basically going to die before we're 30, and we might die from a heart attack before we're 20. But you could be like I am. You could be an AA. You could be a heterozygote where you can handle cholesterol a little bit, but you can't handle it great. And what has been found is that diet can have an effect by reducing your LDL by maybe 10%. But a better choice is a statin, like Lipitor, or I take simvastatin. Let me type it out here for you. I'll get it smaller. That's what I take, simvastatin. Okay? Now, when I took Dr. Lander's class at MIT, and I've read other literature on it since, here's what I learned. Initially, when people started to take statins, the medical community didn't really know whether or not it prevented heart attacks. But they did know that it could reduce blood levels of LDLs by as much as 60 points. And it was very effective in doing that. Well, it just so happens in the last couple of years, clinical trials and good research has been completed and has proven two things. One, if you're a heterozygote like me, like I am, and for this trait, and you take a statin, then you will dramatically reduce the incidence of first heart attacks. And if you are a person who has had a heart attack in the past, and you start taking statins, follow your doctor's prescribed regimens, it also dramatically reduces your chances of a second heart attack. So, statins are a good thing, and eating too much fat is a bad thing regardless. And woe to those who are homozygote recessives. There's nothing we can do for them at this point. Scientists are working on it, and hopefully something will come from their research in the near future. Thank you. Talk to you later.